Which of the following is the most likely cause of these findings? A 70-year-old woman with a history of hypertension and type 2 diabetes presents to the primary care physician for a routine checkup. She has no complaints and reports taking her medications as prescribed. Physical examination reveals a blood pressure of 150 over 90 in both arms. Palpation of her radial and dorsalis pedis reveal a notable pipe-like hardness. And ankle brachial index is performed and found to be 1.5 on both sides, which that means nothing to me. Which of the following is the most likely cause of these findings? Okay, so pipe-like, I know there's a word, there's a diagnosis that I'm thinking of, and it's like is it Monkeberg arteriosclerosis, something like that.
Okay.
Yeah, I would say it's Monkeberg arteriolosclerosis, so I would say that.
Okay.
But yeah, I'm giant cell arteritis. No, Berger's disease is smoking. I just think about smoking. Atherosclerosis is very common in type 2 diabetes, but this is not like sensation filling. It's more like you have you have like a hardness of this. So I wouldn't say that. I would say this. I would say that.
Okay. So let's see kind of the difference here. So arteriosclerosis, thickening, fibrosis, small arteries, arterioles, usually with hypertension, diabetes. It can lead to reduced, but does it not typically cause the pipe-like hardness of arterioles or an ABI of 1.5? Medial calcific sclerosis, patient's age, hypertension, diabetes, elevated blood pressure, pipe-like hardness, and an ABI of 1.5 are considered medial calcific sclerosis or Monteber's arteriosclerosis. So this is kind of tricky here. So do you see the difference between the answer choices?
Yeah, arteriolo and arteriosclerosis.
Yeah,
Yeah,
so
I know the difference. I
yeah,
think at least.
yeah, so the minor difference here is that LO is like you're talking about your um not your big vessels, right?
Your
You're talking
super
about your
small artery. I mean, yeah,
yeah, you're
yeah.
talking about your small. So I think this is a little bit tricky of a question, right? Because I think that you are exactly correct, and it's Monteberg. And the reason why you know that is pipe-like, but arteriolosclerosis is the small, right? Medium to small. But if you're talking about Monteberg's, you're talking about also like your medium to large vessels, right?
Hmm.
That you can actually palpate, right? But let's talk about the ankle brachial index. Talk to me kind of what you know about that.
I really don't know anything about it. Ancobrachial index is performed. I mean, I know nothing about it. I know nothing.
Okay, let's look this up here. The ankle brachial index. What is it? Okay. Non-invasive test assess peripheral artery disease by comparing the blood pressure of the ankles to the arms. It helps diagnose blockage of the arteries, legs, determine severity of peripheral artery disease, and guide treatment. So practically, what it is, right, is that you take blood pressure of your arms and your legs. Okay,
Mm.
and you compare the difference. You make an index, right? In theory, right? In theory, it should be exactly the same, right? Your
So if
arm
there's
and
any
your leg.
difference at all, there's like a hardening or some type of like blockage, like it says.
Exactly, because peripherally, right, one might be worse than the other, and so in theory, it should be the same. If it's different, right, you have a what is it called? If you have an index that is greater than one, then you know that you have, like you said, either some stiffening of the arteries or atherosclerosis or peripheral vascular disease, things like
Mm.
that.
Okay, okay.